As a clinician, how have you seen, or how many cases do you see with cognitive decline? I know for myself, a good bit of my patient population are seniors, so it's definitely something we're working on.
And then also in the functional medicine space, brain fog is such a prevalent symptom, right?
Yes.
And then just outside of, obviously, we're talking about the progression of disease here, especially with Alzheimer's and dementia, but
Mhm.
also working in the functional space, we also work at optimizing health, right? Many of our practitioners look at maximizing health and optimal health for their patients as well. And what are those things? What does that look like, right? Increased focus, increased memory, increased brain function, increased energy. These are all parts of that neuroinflammatory picture. So
Yeah.
this has an impact not only in the disease progression, but also in optimizing health. So when you're looking at some of the root causes that we're going to be discussing about, right, you want to start to think about, okay, how does this look for each of my patients in where they're at in their health, right? And you might have patients that are trying to prevent their disease progression, and you might have patients who are trying to optimize their health. And all of these aspects, you can utilize an aspect of this in all of those different phases of their health.
So good. Yes, a reminder of focusing on prevention and not just management. So good.
Absolutely. And then
Yeah.
you asked about how often am I seeing it. It's funny. We were talking earlier about our week, right? So
Yeah.
this week I've been primarily focused with all the practitioners that I am overseeing with the academy. The number one thing that I'm seeing this week is brain fog
Mm.
and cognitive decline. And guess what the main issue is? It's actually environmental exposure to mold. So I have
Ooh.
run through so many mold and mycotoxin tests with practitioners and
Yeah,
gone through some of the things that we're going to be discussing today. So I'm really glad that we're diving into this.
definitely. And man, I mean, post-COVID, so many folks have been struggling with brain fog and memory issues. So it's definitely not a condition or challenge that's only for the elderly, for sure.
Absolutely. It's
Yeah.
for the majority of our population, really. And it's because we're inflammation investigators, right? So, and that is involved with neuroinflammation. So, let's talk a little bit about neuroinflammation here and some of the causes and how it causes neuronal damage and dysfunction, leading to some of the issues and the symptoms that Dr. Sarah was referring to. So, neuroinflammation, this is when inflammation occurs in your brain or your spinal cord. It's driven primarily by the activation of what's called microglia. This is the brain's resident immune cells. So, what it looks like in a healthy brain is that these brain cells, right, these immune cells in the brain, the microglia, they are meant to help clear debris and protect the neurons. But when they're chronically activated by systemic inflammation, toxins, infections, metabolic dysfunction, these cells are going to release pro-inflammatory cytokines. They're going to release oxidative stress. They're going to have excitatory neurotransmitters that can harm the neurons, right? And these can lead to some of the symptoms. So let's take a look at an image. This was done in 2015, and this was a study done in Nature Reviews of Neuroscience. This article is really highlighting the impact that neuroinflammation has on the development of Alzheimer's disease. So we see in this image here what a healthy brain looks like. You have communication between the microglia cells, you have the protection of the astrocytes. This is neuronal homeostasis. Within a disease state or progressing into a disease state, what we're seeing is that there's a proactive, pro inflammatory phase that keeps occurring that chronically, that leads to neuronal damage, and these can lead to the progression of disease factors, right? And it is this environmental environment, or this inflammatory environment, that can really disrupt that signaling between the neurons, and it can impair mitochondrial function. It could damage the blood-brain barrier. It can lead to neuronal dysfunction and ultimately cell death. So how this shows up in the clinic is going to be cognitive decline, such as memory loss, slower processing. This happens with many of our patients, right? Brain fog, we're seeing this often with our patients as well. Fatigue is another main symptom that we often see. Mood changes. How often are we dealing with patients who have anxiety or having depressive symptoms, right? And all of these can lead for an increased risk of neurodegenerative diseases. So, from a functional medicine perspective, neuroinflammation is often really a downstream effect of upstream imbalances. What we mean by that is, if you address some of the upstream causes, such as gut health, the immune system, detox pathways, these can typically help with neuroinflammation as well. This is why it's really important to do a effective intake with your patients. Look at all of the different body systems that are connected with each other, and then figure out which is going to be the primary upstream system that you want to work with, that is going to help all of the other downstream effects, right? Like I was saying, a lot of times it's your gut. That's why we hone in on the gut so often within the podcast, and also within the program itself, because often, if you address the gut imbalances, it's going to help with all of the downstream effects, including neuroinflammation. And this is going to go right into our quiz 2. So let's pop up that question here. Now that you kind of understand what neuroinflammation is, which of the following best describes neuroinflammation and then its impact on cognitive function? Is it A, neuroinflammation is a normal part of aging that does not affect cognition? Is it B, neuroinflammation involves chronic activation of the microglia? This leads to neuronal damage and cognitive impairment? Or is it C, neuroinflammation is caused solely by head trauma and does not relate to systemic health? Or is it D, neuroinflammation only affects motor function, not memory or attention? All right. So if you picked answer B, you would be correct. We talked about neuroinflammation involving the microglia, right? Those are the immune cells within the brain. And when there is chronic inflammation that's occurring, it can lead to an impairment of signaling. This can lead to neuronal damage and cognitive impairment. You're going to have all of those pro-inflammatory cytokines, the oxidative stress. This is going to lead to symptoms such as brain fog, memory loss, and even an increased risk of dementia. So now, instead of just trying to manage the patient's symptoms, the most challenging part and the most rewarding part of patient care is to find what is causing or contributing to neuroinflammation. Again, we are those inflammation investigators. And this is what exactly these are all the things that we exactly teach in the Advanced in Clinical Functional Medicine program.
Tonight we're focusing on cognitive decline, but as you mentioned, those who have anxiety and depression,
Mhm.
those are conditions that are driven also by neuroinflammation.
It's a major part of it.
Yeah, yeah, for sure. This shows the ways in which heavy metals such as lead, mercury, arsenic, aluminum, and cadmium can induce oxidative stress in the central nervous system, and the ways in which they contribute to neurodegeneration. So at the top, we see these five heavy metals, and they're causing quite a bit of inflammation to the brain. Now, these are some metals that, of course, are in our food sources, but they can be in our water, particularly if we're not drinking filtered water, as well as if you are a smoker, and of course, living in a rural area or near a golf course, along with occupational exposures as well. And what we'll see is that the exposure of these heavy metals in the brain causes changes in the neuron. And what we see is development of oxidative stress. We begin to see mitochondrial dysfunctions. The neuronal cells don't begin to function as they normally will. We also begin to see an aggregation of alpha syn proteins. These are the same proteins involved in the development of Parkinson's. And so we begin to see an increase in Lewy bodies, which also is presented in Lewy body dementia. With mitochondrial dysfunction, we're going to see an increase in those reactive oxygen species, excuse me, an increase in superoxide dismutase enzyme activity. We're going to see a decrease in that. So we're going to see an increase in oxidative stress and a reduction in our body's natural ability to reduce the inflammation through enzymatic activity. And what we're going to see is neuronal death, particularly around those dopaminergic neurons. Then we're going to start to see changes in motor function and sensory impairment. And then generally, we begin to see the development of dementia as well as neurodegenerative conditions like Parkinson's. So let's talk about some of the ways in which heavy metals can lead to neurological damage. So heavy metals disrupt brain health by, of course, as we mentioned, leading to oxidative stress. Particularly mercury and lead are known to generate quite a bit of reactive oxygen species, and that can overwhelm the brain's antioxidant defenses. Also, excitotoxicity. Some metals can actually alter glutamate signaling and could make our neurotransmitters a bit more excitatory, and that can lead to neuronal injury as well. And then also, heavy metal exposure can disrupt the blood brain barrier. And so they can impact and degrade the integrity of the blood brain barrier, allowing more toxins and inflammatory mediators to enter and inflame the central nervous system. Now, the top three neurotoxic metals you should keep your eye out for are mercury. Now, of course, we know the more common sources of mercury are large fish and dental amalgams. They have mercury has been associated with memory loss, mood changes, and neurodevelopmental issues. The second is lead. This is a well-known neurotoxin. Hopefully, we've been able to kind of clear out all of the old paint and pipes that may contain lead, but it's definitely something and definitely worth inquiring about on your intake paperwork with your patients. And then the third is aluminum, found in some antacids, food packaging, personal care products, and it's been implicated in mitochondrial dysfunction as well. Now, the challenge is heavy metals are not easily removed from the body. And so, for example, lead is known to accumulate in our bones, and it has a half life of 25 to 30 years. And so, this is why it's so important to learn the proper evidence based protocols to help your patients. And you can find all of those protocols in your dashboard once you log in and get reacquainted with those modules.
Let's talk about the body's master detoxifier. And this is what we call the master antioxidant. This can be really, really beneficial for inflammation in general. And it's also really beneficial for helping our body detoxify. And this acts mostly on the neuronal damage, and then it's also going to be helpful with depletion. Many of our patients that have some sort of neuronal damage will have some sort of depletion in their oxidative capacity, right? We talked about it with the heavy metals and environmental exposures, the omega-6s and omega-3s, and then even within the homocysteine levels. What does that lead to? This leads to oxidative stress. And one of the one of the major supplements that you can do to address even all three of these is glutathione, because it's going to help with reducing neuroinflammation. It's going to be protecting the neurons, the oxidative and the mitochondrial damage. It's going to help with the detoxification with environmental toxins like heavy metals, even mycotoxins and mold exposure. And it's going to support cognitive performance and memory. This is a major one if you are working in optimal health and you are working on improving focus, cognitive performance, and memory with your patients. You want to look at something like a glutathione. And this is going to help with cognitive care, especially with our patients experiencing brain fog, the memory loss, and even the high toxin burden as well.